Hi, I'm Dr. Gray with Perfect Balance Health. We're the hormone experts, and today I have a very special guest, Dr. Pickle. Some of you may wonder, who is Dr. Pickle? Well, Dr. Pickle is my avatar, someone who goes out into the world giving hope to people that they can have health and longevity. So Dr. Pickle, we have a lot of questions today about health, wellness, and longevity. And we're going to start with the first question, which is, what is longevity? Well, thank you, Dr. Gray, for introducing me today. The question of what is longevity is often confused because is it lifespan, health span? Well, it's both actually. Lifespan is how long you actually live, but health span is the quality of life where you live without disability and suffering. So longevity is both and is very important, and that's what I'm all about. Dr. Pickle, is it ever too late to start hormone treatment? No, but it has to be taken as at an individual level, at an individual person's situation. So it really depends, but I have to say testosterone for men and women is a great hormone, and we can usually start that at any time in your life. Dr. Pickle, what hormones do you think are most important? Well, it depends. Depends. Women, estrogen, progesterone, and testosterone can be important, but again, it depends on the individual. For men, it's mostly testosterone. And could you show us what you do on a regular basis, like what your daily routine is? I do my transdermal cream every day, and I do I do a pump like that, and then I massage it in, and that's my estrogen. Then I have progesterone, and you need progesterone, especially if you have a uterus, because you don't want to get uterine cancer. And it also is very beneficial for helping you feel calmer and sleeping better. And so I take one of these at night, so I won't take it now. And then I do my testosterone. And this is an injectable, and I basically just take a little out of the bottle, boom, boom, and then I inject it into my love handles once a week, and I'm done. And then, of course, I do some peptides, and those might be, 2 or 3 times a week, and those are for different reasons. But this is my hormone regimen. So, Dr. Pickle, what kind of conditions do you use hormones and peptides for? Well, basically, hormones do a lot of things. They work in the body in hundreds of different areas, including energy, sleep, mood, weight gain, muscle mass, vitality. So really, as you get older, these hormones naturally go down, and if you want to age better, feel your best, hormone replacement therapy often is the secret. What are peptides? There's a lot of talk about peptides these days. Are they safe? What are they for? Peptides technically are just small chains of amino acids. Insulin is a peptide. GLP-1 drugs that are used for weight loss are peptides, but there's also peptides that help with recovery from injury, from overdoing it at the gym. There's peptides that help with collagen and elastin to give your face more of a glow and help with fine wrinkles. There's even peptides that help with lean body mass and sleep. Like, I'm a real champion of sermorelin. I love that one. It stimulates your own production of growth hormone. And as we age, growth hormone goes down, and that's why we start feeling a little lower energy, slower, not as strong. But there's no reason why you can't try to curve that aging process just a little bit. How do you begin the longevity journey? It's really an ongoing process. It's first identifying what issues you have. Do you have hormone imbalance or deficiency? Are you going through perimenopause, menopause, or andropause for men? Are your hormone levels low? Are you feeling sluggish? Are you having brain fog? Are you having trouble sleeping? Are you having trouble working out at the gym or recovering as quickly? These are all just natural things that happen as we age, but hormones can slow the process down and help you live a much stronger, vital life as you age. And Dr. Pickle, Dr. Gray wrote a book, The Truth About Sex Hormones. Do you know what the key points are that she was making in her book? I think some of the key points in Dr. Gray's book, The Truth About Sex Hormones, that really hit home for me are: one, normal is not necessarily optimal. Reference ranges don't tell the whole story. You might be at a low level on a reference range when you really need to be at a high level to feel your best. Another point is that one size doesn't fit all. We're all unique individuals, and you really have to individualize care. So we need to see your labs, talk about what you're wanting, what you're needing, and then have a discussion on what would be a plan, a longevity plan based on your personal needs and wants for the future. Well, Dr. Pickle, it's been a pleasure. Thank you so much for joining me today and answering all these questions, and I hope we can have you on here again soon. Well, thank you so much, Dr. Gray, for having me here today. It's always a pleasure to be able to talk about my passion, which is longevity and hormone replacement therapy, and I'm here to help. If you have any questions, you want to figure out what to do with your health care and your longevity journey, get a hold of us.